Good evening, and welcome to the Permanente Federation's COVID-19 webinar on physician wellness. I'm Dr. Steve Perotti, Executive Vice President for External Affairs and Communications and Brand at the Permanente Federation and Associate Executive Director at the Permanente Medical Group. I am pleased to serve as your moderator for tonight's webinar. Before we begin, I want to mention that this webinar is being recorded and will be available later on the permanente.org website. And now let's get started. Joining me for tonight's panel are several physician leaders. The first is Dr. Rich Isaacs, who is the co-CEO of the Permanente Federation, CEO and Executive Director of the Permanente Medical Group, and President and CEO of the Mid-Atlantic Permanente Medical Group. Dr. Ramin Davidov is the co-CEO of the Permanente Federation, Executive Medical Director and Chairman of the Southern California Permanente Medical Group, Chairman and CEO of the Southeast Permanente Medical Group, and Chairman and CEO of the Hawaii Permanente Medical Group. Dr. Don Clark is the Chief Wellness Officer of the Southern California Permanente Medical Group, and Dr. Ellie Farah-Habadi is the Associate Executive Director with the Permanente Medical Group. Welcome, all of you. We're gathering tonight on a very special day. Today is National Doctors Day, when this nation celebrates the many contributions of physicians. This past year, during the pandemic, I've seen firsthand the incredible sacrifice doctors and really all healthcare workers have made. That's why we want to dedicate some time tonight to make sure that we talk about the extremely important issue of physician well-being during these challenging times. I want to thank all of you for taking time out of your incredibly busy days to spend some time dialoguing with us on this important topic. So to kick us off on Doctors Day, I want to turn to Ramin and Rich and ask them their thoughts on what this day means to you. Ramin?
Thank you, Steve. First of all, I want to say it's so great to be here with you and with this incredible panel of physicians and leaders in our organization. Happy Doctors Day to you all. Doctors Day is really, really special for me in so many ways. On this day, for some reason, every year, I remember the day I got my first acceptance letter to medical school. This is long time ago, too long ago for me to care to comment on. But I remember I was so nervous. Of course, I was checking the mail every day to see where I was going to, get accepted or rejected to. And I remember I locked myself in the bathroom in the apartment I shared with my parents, and it was from Ohio State University, and it was good news. And that feeling of pride that I had that day, that my family had, stays with me to this day. And I ended up going to UC Irvine, the Anteaters, and didn't end up going to Ohio State. But it was a real proud moment for me. And also getting, to wear that short white coat initially, it gave me a lot of confidence and strength and hope for the future. And I later realized that that long coat not only gave me strength and confidence, but it also gave strength and confidence to my patients, our patients who saw us walking in with that coat to help them during their darkest times. So thinking about those times way back when gives me a lot of pride on Doctors Day, and being a part of Permanente Medical Group and having been trained by Permanente physicians is the biggest pride in my life. I bleed Permanente medicine, and knowing that we practice ethical and high quality medicine, best in the world, that I really believe that this is a source of pride for all of us. So that's what Doctors Day means to me. So thank you for that question.
Thank you, Ramin. And Rich?
Yes, thank you so much, and happy Doctors Day, Ramin, Davidoff, and the entire panel. I'm so grateful to learn that you did not go to the Ohio State University School of Medicine as a University of Michigan grad. We'll talk later about that, but thank goodness you went to UC Irvine. Anyways, National Doctors Day this year in particular is incredibly special. National Doctors Day usually comes in at the end of March every year without much fanfare. It's just another calendar check. But this year, a year upended by by a pandemic, one that put doctors, nurses, and our staff in harm's way for the sake of our patients and communities, this year, March 30th, is very different for me. Heroes work here are the words that define each of our medical centers. But as case volumes diminish and vaccinations become more prevalent, what's happened behind those walls this past year will remain largely unseen and will be permanently etched in our minds. Throughout this once-in-a-century public health crisis, we have seen physician bravery, commitment, teamwork, flexibility, and dedication in the face of such tragedy. As terrible as this pandemic has been, the greatest bright spot for me has been our medical staff banding together to care for our patients. National Doctors Day also provides us with an opportunity to reflect on the practice of medicine, where we've been and where we are heading. And on a personal note, my wife is an internist with the VA in Sacramento who's been involved deeply in the care of patients afflicted by COVID-19. And I have two daughters. My daughter Dana was just accepted to the University of California, Los Angeles, UCLA, go Bruins, for internal medicine residency. And my other daughter, Rachel, is about to start her third year at California North State University School of Medicine. So it's a really special day for me this year.
Well, thank you, Rich. And, as you sort of referenced, this year has been like nothing else. So reflecting on just this year, what do you think has been the biggest challenge facing physicians and other healthcare workers?
Thank you, Steve. I think as in any pandemic, it's the uncertainty and the requirement to pivot quickly and to respond to rapidly changing information and data, which seem to be endless, coming from the federal to the state to our local governments. The COVID pandemic has really created what I'm calling the trifecta of challenge, dealing with the disease itself, the economic impacts of the shelter in place, and then the clear evidence of social injustices that have been unveiled for centuries, and the political unrest that we dealt with this year. Early in the pandemic, we had supply and equipment challenges, supply chain issues, PPE shortages. How do we keep our doctors and how do we keep our families safe? And there were several other challenges, such as responding rapidly to changing CDC and public health guidelines and adjusting to new work conditions. And there was also the emotional toll on the healthcare workers in emergency rooms, ICUs, and in our skilled nursing facilities, nursing homes. Many had to serve as surrogate family members for patients because their loved ones could not be with them in the hospital during their time of greatest need. This has created a huge and lasting toll on our people.
Thank you, Rich. Ramin, mental health is clearly one of the biggest challenges of this pandemic. What specifically should healthcare organizations be looking out for?
Great point. It's something that all of us in leadership, all of us in healthcare organizations have to pay special attention to. Well, first of all, it's the stress of the surge. The stress has been monumental. Many of the stressors that Rich mentioned were especially true during the surges that we saw in Southern California. And I'm sure it's the same everywhere around the country and around the world. There were also additional stressors outside of the hospital and outside of our workplace. So trying to balance the stressors of work and with the concerns at home for the health and safety of our families and loved ones, and the added responsibilities for many of us, for homeschooling and remote learning for our children has been an incredibly difficult thing to juggle for our physicians. And then, there was a climate of social injustice, and bringing that to light over the last year has been incredible. Our physicians, like the rest of the country, also struggled with their personal feelings related to these social injustices that were brought to light in the past year. And that can take a toll on the mental health and feelings of burnout amongst our physician group. We can't ignore how some of our physicians of color have struggled during the pandemic, and with putting in long hours caring for our patients, and then personally seeing what's happening in the world around them on some really difficult and tough societal issues. So All of these things have an impact on our physicians. Burnout was already a problem and it's gotten worse. It's a growing problem. And the impact of the COVID pandemic has exacerbated this issue. Physicians and healthcare workers are without a doubt the heroes of the pandemic, but even heroes need help. Doctors are often the last people to ask for help. And so it's critical for us as leaders and physicians to check in with our colleagues. It's important that they know help is available and that we're here for each other and to help support each other.
Thank you, Ramin. Ellie, just thinking about what we just heard here. So, the physicians themselves have, of course, been in it, right? When it comes to all three of these different crises, the pandemic, the economic crisis, and then the crisis of conscience that is occurring and we're going through in this country. But we're also taking care of people, right? So the people that are coming in day out, the families, they're also going through that. So can you tell us a little bit about the programs and support that TPMG has been providing in that context to the doctors during this time?
Yeah, thank you, Steve. Well, first of all, along with Rich and Ramin, I really want to express my heartfelt gratitude on this National Doctors Day to every single one of our physician colleagues across the nation. And as we've heard, this has been an incredibly challenging time for all healthcare workers and especially physicians. And I'm proud of the fact that before the pandemic and TPMG, in order to address some of these issues around burnout, we had already started to develop a strategy making physician wellness a priority, focusing on joy and meaning in medicine is what we call it. And the three areas that we wanted to focus on were really about culture. How do you support a culture where physicians feel engaged and are supported to bring their best selves to work? And then the second area, practice support, really looking at operations, systems, tools. How do we support physicians in the day-to-day practice? And then the third part of that plan was the personal health and wellness, a physician's own physical health, mental health, and well-being, all being important. So this was before the pandemic, and when the pandemic hit, we quickly recognized that while we still want to stick to these basic principles, we really need to increase the pace and figure out where do we need to prioritize right away based on what physicians need in light of the crisis. So some of the things we did in TPMG is we called together a task force of various leaders, wellness experts, folks that just were in operations. And so we came together and we really quickly looked at implementing some top priorities. And so just to share some examples of some of the things we implemented working in collaboration between the wellness team, HR, operations. First and foremost, we recognize that communication is incredibly important during crisis, communicating with clarity, getting information out. And so throughout the region, our operational leaders hosted these town halls where they could quickly and rapidly share information and hear from physicians about what are the challenges that they were facing. Of course, we all know, personal safety, PPE, that was really huge at the beginning of the pandemic. And we actually leveraged the connections of many of our own physicians to help us get more and more PPE, working with operational leaders, sharing information and following up on these leads. The playbooks that our regional leaders developed to help across in different medical centers, and then the medical centers where they were first hit early on with the pandemic, quickly learning and sharing their learnings with other medical centers really were a reflection of the spirit of collaboration, camaraderie, the integration of Permanente medicine that I think put us on top in terms of being able to manage the challenges of this pandemic. We had physician volunteers offering to redeploy across departments, across facilities where the surges were happening. This had a big impact in terms of, again, helping each other, supporting each other, coming together during this crisis. I also want to talk about our transition to remote work very rapidly. We, in the specialties where it makes sense, right, across the organization, transitioning to being able to provide care virtually both meeting the needs of our patients and keeping our people safe, not having them in the medical centers if there wasn't a good reason for them to be there. In addition, we put in, again, across Permanente, COVID-related benefits, which were really well received when the school closures happened, the childcare situation, right? Many of our physicians really had a challenge with that, and the childcare grants, temporary housing, financial support for those whose spouses had challenges with their jobs and finances were another big area that we implemented. And then finally, virtual education, our continuing medical education series with so much coming so fast and so furious, keeping our physicians abreast of new information from our infectious disease experts and other experts in the organization went a long way. And finally, I want to just mention how important it is that our physicians know that they're incredibly valued. So that was one thing that we as a leadership team talked about, how important it is to continue to demonstrate to our physicians how incredibly valued they are and that leaders are listening and taking their feedback and then making the appropriate changes. So unfortunately, we're not out of the woods yet with the ongoing pandemic, but I feel that we can be very proud in Permanente Medicine in terms of what we've implemented so far. And so thank you for having this conversation. I think it's incredibly valuable and important.
Thank you, Ellie. And Dawn, can you tell us about the physician wellness programs and what you've implemented in the Southern California Permanente Medical Group?
Yes, and I would also like to echo just that what a phenomenal day this is and how much our physicians and quite frankly, all of our teams deserve recognition on this wonderful day. So thank you to everybody. So I'm sure just like in TPMG or any of the other PMGs, we've done an incredible amount of work in this last year. Like Northern California, we've had a physician wellness group down here for going on 7 years. And so we were really able to take some of the programs that we had already created and sort of shine a spotlight on them. So the very first thing we did is make sure that all of our resources were up to date on our physician wellness website so that people could get the support that they needed. To Ellie's point, we made sure to really share with our physicians all the benefits that our teams created for them with childcare, et cetera. And so that was really helpful really early on. We also have psychological support teams in Southern California. And these are groups that generally have healthcare professionals in them. And it could be anywhere from somebody from chaplaincies to person from physician and employee assistant programs, licensed clinical social workers, one of our physician peer supporters, or maybe one of our physician wellness champions. And the intention of these teams was to really go out and proactively intervene in high-risk units like the ICU, urgent care, the emergency department, OBGYN, wherever there was a lot of risk going on to those departments, we deployed these teams. And I've been lucky enough to sit on a few of these teams, and it's really heartwarming to listen to people really share their very moving stories. And I will tell you that I have been brought to tears in many of these stories. They're very emotional. And I will tell you that there are people who try to start sharing their story, but are just unable to because the process that is really difficult. But I will say that on all the debriefing interviews that I've been on, not one person leaves. So while not everyone participates, everyone's very engaged and listening. And I think that speaks to the point that some people are willing and able to talk about what's happened to them, their own emotional events and their processing of their grief earlier than others, but also the fact that even those who aren't comfortable talking, they're listening and they're getting something out of it. And so in those debrief, the other kind of win was that the facilitators are also able to share what our mental health benefit resources are. So if you didn't want to participate in a group, you certainly have enough resources to do individual counseling. So I think those have been great. They meet monthly, they share best practices, and we just try to lift everyone up throughout Southern California. As far as when I think about isolation, we've been isolated for a long time with our EMRs, and we spend a lot of time in our offices charting. And I think COVID actually, contributed in a negative fashion to the isolation that we already have. And so, the town halls have been mentioned. I think the town halls were very important to Southern California, both regionally and locally. And again, in the beginning, we talked about things like obtaining PPE and testing. Then we went into emerging treatments. And of course, now we're talking about vaccine distribution and long COVID patients. The level of transparent and consistent communication was so valuable. I loved the fact that any of our physicians, not just our leadership, but any physician in our organization could go onto our COVID dashboard and they can look and see where are the cases, how many patients are, admitted, how many patients are in the ICUs. And then they could understand why our senior leadership were deploying resources and people to different areas depending on, how each area had been hit by the pandemic. We also were able to engage our physicians in a narrative medicine program. So we launched a 55-word story campaign, really to allow people to express their experiencing having to deal with the COVID pandemic. And again, this was very popular. We had way more participation than I would have ever suspected. And because we have the ability to do analytics, we also really saw that a lot of people, even though they didn't write what they were feeling, they went in and they read the stories. So that was a very, very popular program in Southern California. We also we have short turnarounds in about 50% of our hospitals. Those have been wildly popular during the pandemic. And then in each of our areas, we have physician wellness champions and they have committees. And they have been doing such an innovative, fun work in connecting people virtually, because of course, all the in-person connections, we weren't able to do them for safety reasons. So our teams have done incredible things, virtual dance classes, virtual cooking classes. One of our areas did virtual gingerbread making over the holidays and invited their families. So while we have to be physically distant, we are making every effort to be socially connected. And then I would also say that the other program that's gone on really well, and in fact, maybe even more popular now in the pandemic, is our Finding Meaning in Medicine groups. So those are just a few of the things, and I know we're short on time, so I'll stop there. Thank you, Steve.
Well, Ellie and Dawn, I really appreciate you going through both the system level help that's been provided and also at the individual level. And I just have to comment that I benefited from one of those by getting an apple pie out of the deal with my wife cooking via Zoom, and surgeons teaching internists how to cook apple pie. So thank you. Rich, we actually have a wide audience tonight. So we have, members of all the different Permanente medical groups joining us, but we also have physicians that are not part of Kaiser Permanente or Permanente medical groups joining us as well. So our medical groups are part of a larger integrated model that we call Kaiser Permanente. So do you think that this has helped our physicians? Has it given us any kind of advantage in coping with, I think, what is one of the most stressful events in our professional careers?
Yes, thank you so much, Steve. I think that you've heard it really well from both Ellie and Dawn. It's really about engagement, empowerment, and a sense of purpose that are really the antidotes to these types of challenging times and burnout. I believe that our model definitely removes some of the stress points because of our integration, our group excellence, and our ability to rally together, as you heard, as a team. And I feel that this is a tremendous advantage of Permanente medicine and a marked differentiator from our colleagues that are in kind of fee-for-service practice and fragmented in the community. For example, we had the ability to leverage across our 21 medical centers here in Northern California to support our people, utilizing our space, our staff, and our stuff across medical centers to respond to really challenging conditions that were very dynamic. And our physicians could move across departments and medical centers to help each other. We were also in a tremendous position to respond early in the pandemic. In fact, our involvement at a national level led to further engagement and further empowerment, both antidotes to burnout. I think when we looked at our JAM survey, and Ellie mentioned that, we had tremendous JAM scores in 2020 because of the leadership and the systems that we put in place to help respond in meaningful ways. Our physician leaders had the power to change the electronic medical record to adapt to the changing dynamics of personalization of care and video visits, which were so critical when our patients couldn't come in. We were able to change protocols and use new technology, which further supported engagement and meaning. And for those of you that are familiar with the VUCA concept, which stands for an environment which is volatile, uncertain, chaotic, and ambiguous, we had the ability as a team to respond with vision, understanding, clarity, and marked agility across all of Kaiser Permanente. And I've seen this play out in big ways across the past 13 months.
Well, thank you, Rich. Ramin, look into the future. What do we need to be planning for in terms of supporting physicians going forward? What does, from your perspective, recovery look like beyond the pandemic?
Yeah, thank you, Steve. First we have to acknowledge that this trauma that all of our physicians, all of us have experienced will last beyond the pandemic. So while thankfully and hopefully the pandemic is coming to an end, it's important that we recognize that many of our physicians and healthcare professionals are experiencing a collective trauma that will potentially last a very long time after the pandemic. And so we have to recognize the presence of this trauma and address it. That's the first critical step, that this is real, it's present, and we have to take specific steps to address it. So some of the things that we can do to begin to address it, and many of these things have been beautifully and eloquently talked about by both Doctors Farabadi and Clark, there are several things. One thing is to help provide collective meaning and sense of belonging together. So what I often do is I often ask for a moment of silence before beginning all of my meetings to recognize our colleagues and patients and perhaps even friends and loved ones that have lost their lives due to COVID. It's really important for us to acknowledge that people have experienced tremendous trauma, and it's important to acknowledge and respect and pay our respects to those who have lost their lives. Also, helping to reconnect people to the meaning of their work individually and together. Physicians have a great opportunity to tangibly make lives better and to comfort those who are sick and to transform lives through healing. And that's a unique honor and ability and accountability that we all have. It's also important to encourage physicians and staff who need help for certain clinical conditions that may emerge, such as PTSD, which is a real phenomenon after this pandemic, issues with depression and anxiety, substance misuse or use disorders, for those physicians to get help and to feel safe seeking help. I think that's super important. And also, investing in physician wellness programs is going to be very important for healthcare organizations. We have to find ways to invest in these programs and to cultivate joy in the practice of medicine and actively support physician well-being. These programs should also be regularly assessed to ensure that what we're putting forward, the programs and the policies and everything that's being put forward is responsive to the evolving needs of that medical group, of our medical group. So those are just some of the things that we really need to pay attention to and take steps on and take action on.
Well, thank you, Ramin. Thank you, all of you. I can't resist asking at least just one more question before we go to the audience questions. So, it's been a challenging year for all of us on a personal level as well as professional level. So I want to ask all of you, how do you recharge? How are you finding balance through all of this? And why don't we start with you, Rich?
Thank you, Steve. What a great panel. For me, connecting with family and old friends helped me re-energize throughout this past year. In fact, I relied on my connections this year really more than ever. I was connecting with grade school friends that are back east, high school, and college, and just catching up and remembering all of our great times together and just stories from the past and reminiscing, which was really, really fantastic. This year I became a Disney Plus subscriber, so Hamilton was big. And then the Mandalorian date night with my wife on Friday nights when it came out was really awesome. And then I also found time to mountain bike ride and also golf. So.
And Ramin, how about you?
That's great. All the things I heard from Rich are really great things. I similarly, I found that it helped me to stay focused on hope and being hopeful. To say that the challenges that we face and that we've been challenged I think is an understatement, and everything in our capacity and our resolve was tested like never before. And the way we leaned in together as a medical group, as a society of healers and professionals has been incredibly inspiring for me and keeps me going. On a personal level, I also enjoy going out for walks with my wife. We've gone on more walks than in the last 22 years of our marriage. And I also take one of my sons. I have 3 sons that he loves to go out on walks with me. He's 11 and he really enjoys it. And we also take our dog Beethoven out with us once in a while. And also I like basketball. So whenever I can find a basketball court somewhere, I just like to go shoot some baskets. I don't make too many shots, but I definitely try, and it's fun to get out there. It's usually in a park somewhere. It's good weather, and that's how I rejuvenate.
Thanks, Ramin. How about you, Dawn?
Yeah, I think the most important thing for me in the beginning was making sure that I was staying connected to friends and family. So my family lives all over. So we instituted a Sunday night Zoom night at the same time, and whoever can come comes, and it's wonderful. And I'm happy to report that next weekend I'm going to see my parents, who I haven't seen in 14 months, to give them a hug because they're fully vaccinated, as am I. So we're looking forward to that. I think honestly, the teamwork that I've seen, I'm not talking about physicians, but full departments coming together and really, supporting each other through the pandemic. That has been one of the biggest joys. I think some of the changes that we've had to put in because of the pandemic, the virtual care, et cetera, are actually silver linings. I think we've taken big steps, and I think we're going to probably keep some of them. On a personal note, I must exercise every day. My husband would say I'm a 2-year-old Labrador that needs walking. So I have to get my walking in every day. I became a vegetarian when the pandemic started. So that's new. I've been doing lots of fun cooking for that. Catching up on some Netflix that I never thought I would see. I am doing Downton Abbey. I know most people have already done it, but I'm enjoying it now. So we've been doing some chores around the home since we can't travel. So there are silver linings to the pandemic. And in the darkest hours, I really try to focus on that and just really my gratitude for working at this organization, which I truly believe in.
That's great, Dawn. And how about you, Ellie?
Yeah, I have to echo the sentiments about this amazing professional community that we have the privilege to be a part of. The conversations with colleagues, whether it's individually about the different, challenges everyone's been facing, or with our physician support teams, our department technology leads, our physician health and wellness leaders, our physicians over HR, all these groups, you know, focusing on how to support our people. That was really important and helpful to keep me going. And I would say the one word that comes to mind is compassion. Having compassion for our patients, having compassion for the families, having compassion for each other, and having self-compassion, because, you know, as leaders, it's been a tough year and we don't always get it right, but having the self-compassion to understand this is, you know, these are real problems and they're not problems we faced before, but we're doing our best. So I think focusing on compassion. And then I also have to mention having two daughters in middle school who were in distance learning most of the year, which was both challenging and fun, having the opportunity to spend more time with them and just being silly and having fun. That was really, really important in terms of getting me through this pandemic.
Well, thank you all for sharing, you know, what is really a diverse set of experiences, which I am sure, you know, the physicians of our medical groups have their unique stories. So thank you for sharing those. We're going to now turn to questions from the audience. And if you would like to submit a question, please go ahead and submit it now via the Q&A function in Zoom. And in fact, we've got some that have already been coming in. So Rich and Ramin, our audience asks, you've shared your experiences as medical students. And there's a related question here regarding, you know, we spoke about physicians and the services that we're providing to physicians. Are there plans to support new physicians, medical students, residents, given the difficulty of this pandemic, which of course has hit them as much as anyone else?
Yeah, sure. I can start us off with that a little bit. I think in Southern California, especially, you know, we have a very robust graduate medical education program with residents. And, you know, we really endeavor to have everything that's available to our associate and partner physicians to also be available for our residents. And so we really feel that they feel the stress and the you know, absolute chaotic environment that we've all been. Of course, they experience it the same way that we have. So we want to make sure that our resident staff also are supported and protected to the fullest of our capability. In addition, we are, as all of our Permanente medical groups have, the connection with the KP School of Medicine, with the medical students there. And it's really important for us to continue to stay connected with the medical school, with the medical students, and to make sure that they also feel supported. Many of them have traveled you know, across the country and are living in the Southern California area by themselves, separate and away from family. And so we've done everything we can to stay connected with the medical school, with the deans, with the faculty, as well as with the medical students, to be able to provide Permanente support to our medical students, because they absolutely feel it as much as we have been in healthcare. And so I think that's a terrific question, and it is something that is on our radar, and we actively address many of the issues related to what we've been experiencing with our residents as well as our medical students.
Very well said, Ramin. I'll just echo what Ramin is saying. I think it's really critical that we support the future of medicine. And, you know, I've personally been participating and supporting medical students through both of my daughters. You know, this is really a once in a century kind of situation. You learn about, well, Steve knows a lot about infectious disease. You learn about this, but you're actually living through a pandemic, which has all of the challenges of uncertainty. In the beginning, you know, there's a fair amount of fear. How do medical students show up in an operating room when they potentially could, you know, subject themselves to harm and injury? So I think it's incredibly rewarding to support our medical students and our, graduates, medical residents that are rotating through all of our medical centers. And absolutely, they're part of the workforce. Also the nurses and other ancillary staff. Absolutely, we have to be thinking about the wellness of everyone involved in the care of these patients.
So, Rich, this is another question. It has to do a little bit with the transformation of medicine. And this predated the pandemic, but has been accelerated. And there's been a significant shift from, in-person care to virtual care to, something in between, whatever is going on right now. And so one of the questions that is being raised here is, are we going to continue to have that? And probably more importantly, from the standpoint of wellness, is there going to be flexibility either from the patient perspective or the provider perspective when it comes to virtual appointments?
So this is an excellent area to be focused on, because I think pre-pandemic, the industry was moving towards consumerism, patient centricity, and how do we meet the patients where they are? I know that all of the Permanente Medical Group boards of directors were actually addressing this before February of 2020. What we saw with the shelter-in-place orders is absolutely an acceleration of technology integration in how we practice. We were forced to. And when you look at the exponential growth in the application of technology applications, apps, e-visits, the ability for us to provide care in new and interesting and exciting ways, absolutely, we've learned a tremendous amount. I think our job now is to harvest those learnings and identify where is the best value created. A televisit is a televisit, but we need to make sure that the televisit creates value and we meet our patients where they are. There's a whole bunch of work that's being done in the Permanente medical groups through the Federation to create the technology tools and the systems that make it easy for physicians and clinicians to do the right thing. And we're also learning a tremendous amount of where this technology creates value. I think we're entering a very, very exciting time in healthcare. We just heard last week that Amazon proposes to create a very consumer-centric 60 seconds on demand virtual care. I believe with our infrastructure and our integration, we can do Amazon better than Amazon. And this is going to be a really exciting opportunity for us as leaders and as physicians in these medical groups to differentiate.
Yeah, I completely agree. If I may add to that, Steve, Rich said it beautifully. And, the venues of care have been redefined forever. There's no question about that. The virtual care, virtual visits, whether it's phone or video or chat, telehealth services are going to need to be there for us to stay competitive in the market and continue to provide safe care for both our physicians as well as for our patients. So these will continue after the pandemic and there'll be a choice for our patients. But also it'll have to be with the consideration that it provides flexibility for our physicians. And we also have to keep in mind that it's easy to kind of get overwhelmed by technology as well, because it is not easy sitting in the chair all day long, going from virtual visit to virtual visit, to virtual visit, back to back to back to back. So I think we have to figure out ways to include physician wellness elements into our virtual approach, just like we did with our face-to-face visits. So it's a really exciting time. Rich is absolutely right. We are positioned very well to make this transformation happen. And there will be intended and unintended consequences that we have to be mindful of, and to make sure that our physicians as well as our patients are served well throughout the transformation in such a way that it's sustainable into the future.
So, it's amazing how fast 45 minutes flies by when you're talking to some of the best leaders in medicine in the country. So I want to thank Rich, Ramin, Dawn, Ellie for sharing, your incredible insights, the incredible work that you've done. to support the physicians and also to speak to the future of where we're heading. So I want to thank all of you, thank our audience for joining us. One of the comments that came through in the chat is, it's good to see us coming together like this. How are we going to show that more? How are we going to display that more? I think you've laid the groundwork for, having more of these kinds of sessions and series going forward. So I want to, thank all of you and end with my deepest gratitude to every single healthcare professional out there, physician or not. Your contributions during the course of this pandemic have been nothing short of inspiring. So good night to all of you and stay well.